Which scales would you use to weigh the success of bipolar I therapy? You might use the YMRS scale to measure manic and mixed symptoms. You might use the HAM-D scale to determine the degree of depression, or the bathroom scale to monitor changes in weight. Equetro yields positive results on all three. Dispensed in extended-release capsules, Equetro is the first and only carbamazepine indicated for the treatment of bipolar I disorders. Please read this important safety information regarding serious reactions reported with the use of carbamazepine, including Stevens-Johnson syndrome, aplastic anemia, agranulocytosis, and suicide. Clinical studies have shown Equetro to be an effective therapy by a number of measures. Let's start with the YMRS scale. As you can see, based on weekly scores from a baseline benchmark, Equetro significantly reduced manic and mixed symptoms. Positive effects were felt as early as 1 week, and a 53% improvement was achieved in 3 weeks. Before starting Equetro therapy, you should conduct a hematological evaluation. Obtain a baseline using pre-treatment CBC that includes platelets, reticulocytes, and serum iron. Patients who exhibit low or decreased white blood cell or platelet counts should be monitored closely. Discontinue the drug if you see any evidence of significant bone marrow depression. Results on the HAM-D scale are also impressive. As this graphic indicates, patients in a treatment group showed no signs of increased depression over a 3-week period. An important measure for the patient, of course, is the results shown on the bathroom scale. A series of short-term and long-term evaluations have shown that Equetro caused no significant weight gain. As a mood stabilizer, Equetro is an effective first-line therapy for bipolar I disorders. The drug represents a valuable addition to other approved medications for the treatment of manic and mixed episodes. In fact, Equetro is the only carbamazepine to receive FDA approval for treating these symptoms. Take a moment to read this important safety information. Before you consider prescribing an atypical antipsychotic medication, you should carefully weigh the benefits of Equetro. This chart shows some of the most common adverse events of Equetro as reported in double-blind controlled trials. The most common adverse events were dizziness, somnolence, and nausea. It's important to note that the most frequently reported adverse events tend to decrease over time. This chart shows the results of a study comparing the adverse events of Equetro versus a placebo over a 3-week test period. The results of safety and tolerability testing are also encouraging. Over the course of a 6-month study, adverse events were generally mild, with headache, dizziness, and rash being the most frequently reported events. Please take a moment to read the important information regarding contraindications, including bone marrow suppression, hypersensitivity, and pregnancy. With Equetro, the patient receives a consistent delivery of carbamazepine therapy thanks to the patented Equetro extended-release delivery system. In this graph, the blue dotted line illustrates how the patented Equetro extended-release delivery system reduces emotional peaks and troughs, compared to a more dramatic up and down pattern achieved with immediate-release carbamazepine. Here's a closer look at how Equetro delivers a consistent release of therapy. The capsule is comprised of 25% immediate release beads, which are rapidly absorbed when swallowed, 40% extended release beads that gradually dissolve over 8 to 12 hours, and 35% enteric release beads with pH-sensitive coating to absorb slowly in the GI tract. Equetro has distinct differences from osmotic delivery. For instance, Equetro can be taken with or without food, with little or no difference in how quickly it is absorbed. Naturally, there are certain potential drug interactions you should be aware of when prescribing Equetro. Take note. Equetro is available in 100, 200, and 300 milligram capsules. The recommended starting dosage is 200 milligrams twice daily in divided doses. Keep in mind, Equetro is the first and only carbamazepine indicated for the treatment of acute manic and mixed episodes of bipolar I disorders. As studies have shown, it presents a combination of positive factors, including a low incidence of weight gain, no worsening of depression, and high tolerability and safety over time. Given these many advantages, we encourage you to prescribe this effective medication as first-line therapy. Regardless of which scale you use to measure the success of bipolar I therapy, Equetro can deliver the results you desire. Please take another moment to become familiar with the important safety information.